A major nonprofit organization that operates sexual health clinics across British Columbia is warning of sweeping closures. As Sophie Hansen reports, rising healthcare costs and inflation have made it impossible for the clinics to operate without financial assistance.
We've got various supplies here for STI testing.
Sexual and reproductive services like this may be more difficult to access in the near future. An open letter released by Options highlights potential clinic closures, citing insufficient funding.
This comes on the back of 12 years of no substantive increases and constant uncertainty within Options about whether or not we will be able to continue to offer services. Once we wrote to the minister, we knew that there was going to be word getting out.
These 30 clinic locations support more than 14,000 patients each year, providing services like STI testing and treatment, cervical screening, and birth control. Options is hoping for $800,000 in emergency bridge funding from the government.
We did have a meeting with the minister last week, which is where we thought we may have received some updates. At this time, she's committed her support to us, but was unable to give us any information about funding and whether a decision was going to be made.
After hearing of the potential closures, advocates jumped to echo the importance of these services.
I wouldn't have all of this information that I now know, and I wouldn't know my body as well if it weren't for clinics like Options. There's not enough of them out there. It's not taught enough in schools, and more people need to be able to have access to locations like these.
For Melius, the support has been bittersweet.
It's actually been overwhelming and heartwarming and heartbreaking to read the stories, because we knew and know that we play a crucial part of the landscape in BC.
The deadline for funding is January 31st, but until then, they will continue to provide services as usual. Sophie Hansen in Vancouver for BCIT News.